let's start with a very basic presentation about the research in medicine, what and why. So let me tell you the bookish and traditional definition of research in medicine. It says that research in medicine and health is certain disciplines conducted using scientific methods which aim of acquiring new knowledge about health and disease. It means each and every time you think about research, you should think about new knowledge or validating the past knowledge. Suppose, let's take a real life example. Suppose you wake up in the morning and go to the bed at night, right? In between these two events throughout the day, you ask hell lot of questions to yourself, including whenever you wake up in the morning, you just think about what kind of foods I want to get in my breakfast. If I take a little more protein or fat stuff, then what would be my health balance? Then you think about that what kind of vehicle I should acquire to go to the office today, whether I should take cab or I should take out my car. And after going to office, there are a lot of things that you think about, like what kind of meeting you should attend, what kind of class you should attend, and what people are saying about you. This is a very common gesture in Indian tradition. And you often think that why people are so much interested in my personal life. And whenever you ask these questions to yourself, unknowingly or knowingly, you start investigating the answers of these questions, right? And when you investigate those answers, you get certain data out of it that why people are saying like about you, what in the meeting, what you should say, and what are the repercussions in classes, what you are learning, and what are the outcomes. So all these questions you ask to yourselves, and you knowingly or unknowingly collect the data for it, right? And whenever you collect all those data, you try to analyze those data in your mind and try come out of certain important conclusions or inferences out of those data, right? So these inferences and conclusions often tend to resolve the quest of your mind. So research is like this. Research is not a very rocket science that you cannot understand. It is basically a real life events that we knowing or that we knowingly or unknowingly apply to our life. So in research, similarly, a research starts with a quest, an idea, which converts to the research question. And then to answer that research question, we frame some scientific methods together called research methodology. And according to that pre-specified standard methodology, we collect data called data collection. And after we gather all this data, we analyze those with a special method called biostatistics. And after that, those biostatistical inferences actually satisfies our research question. So we get the answer of this research question at the end of our study. And starting from your very idea, from research questions to the methodology to the biostatistics, and ultimately the inference or conclusion you draw out of that statistical consideration, all these events you put together to a paper called your research paper and you publish it to let the world know that what kind of research you have conducted and what kind of inferences you have got out of those uh, processes. So research is like this. Now, importantly, for research, we understand three things basically. Okay. The first one is basics of research methodology. It includes the study designs, their analysis part, their data collection methods, and when to consider which study designs. So all these things. Second one is the basics of biostatistics. Biostatistics starts with the consideration of data, understanding data, data structure, and what kind of data we should consider for which type of biostatistical analysis. So this inferential or descriptive part is known as the applied biostatistics. And the third one is importance of research and biostatistics and how to put together all those to make a meaningful conclusion. So today we will just stick to the basics of research methodology and how this research works. So the basics of medical research. The first question comes to your mind that is this a rocket science? I would tell you that definitely no. Research is something based out of the real life examples. Research is something which is quite practical. Research is not something which is astronomically uh, rocket science. So the basic objective of this lecture is the why research, why we should conduct the research. Are we scientists that we should conduct the research? Are you be able to be a scientist uh, after conducting one or two research? So the scientist, research, lab-based research, all these terms are quite vaguely attached together. Okay, everybody and anybody is doing research in their daily life. It's not necessary that they have the knowledge of the research methodology or not. Just the thing is that if you have a little bit knowledge of the research methodology and biostatistics, then probably you will be better understanding all the events that is going all around you and understand the scientific aspects of each and every studies that is going on. Second one is there any place of research in clinical practice? Often clinicians says that we should stick to our patients, we should stick to our treatment plans. Why should we go to the research? Why the hell would we understand the research? Why we should make effort out of this? Instead, I will put some effort into seeing the patient, evaluating the patient, into the chamber, into the treatment so that I can earn money, fame, name. Why research? So for them, the basic answer is research is something you should know to increment your personality, to increment your life in the medicine. Because research is something worth investing. Okay, because it is a very cream area of knowledge. In Europe and in America, or in Australia, Netherlands, all these Western developed countries, each and every clinician, practitioner, doctor, professor, students have been mandated to know the research methodology and biostatistics because it adds to their personality of the clinical life. The third is the thing I'm saying, what are the elements of confidence in medicine? There are certain elements which will add to your confidence in medicine, no matter you are scientist or not. But if you are a clinician, if you are a doctor, then it should definitely help you. And the fourth one is the way forward, what we should do. Now, the first thing is why research? The basic answer is to fill the knowledge gap. Suppose there is a gap between known and unknown. To fill this knowledge gap, let me give you one very important example. Once, a person went to alpine region for mountaineering purpose. When he was just climbing the rocks, he got injured his knee, and he said that I can't go up because it's so much paining. So some local persons said that okay, there is a herb which if we apply, then probably your pain will be gone. So they have applied those herbs, and drastically that pain reduced, and the person was able to climb the mountain again. So after he came back, after 3, 4 years, he came back. He wrote a book about this particular herb that it reduced my pain drastically within minutes. Following that, some of the scientists was thinking that what kind of herbs he has used. Let me investigate it. So they went to this alpine region and found one or two herbs like this, which actually reduces pain after injury. Suppose herb A and herb B. So they investigated in the lab which what kind of biochemical properties these herbs has, and after that they applied it on 10, 12, 15 injured patients with some external applications or poultices, and they found that suppose herb A is really reducing that pain of the knee. And after that, they started clinical trial. 15 patients, they have not applied those herb, and for 15 patients, they have applied that herb, randomly allocated. And they found that yes, the pain is getting reduced by this herb. So they have discovered that yes, this herb can act on the pain after an injury. So see, knowing knowledge has been translated to a research, followed by that research actually leads to a meaningful conclusion about a new treatment. So the basic purpose of the research is to fill the gap. Second, valid research influences guidelines. Let me tell you a very good example for that. Few years ago, in around 2006-7, there was since till 2006-7 in India, in Bangladesh, Myanmar, Pakistan, all these countries, there was a trend to use the primaquine for the vivax malaria, for the hepatic stage of vivax malaria, uh, for 5 days of regimen. But the WHO's general guideline says that 14 days of primaquine regimen should be followed. But India and surrounding countries was using 5 days of primaquine based on some empirical data and assumptions. However, in 2007, there was a very important published Cochrane systematic review and meta-analysis, which pooled all these clinical trials and said that no, 5 days of primaquine is as good as giving nothing. No improvement is occurring because of this 5 days of primaquine, but 14 days of primaquine has some benefit over the 5 days of primaquine. So, within a very short period, the Indian government and the surrounding, uh, a bit of surrounding countries, they have considered that yes, 14 days of primaquine should be implemented to the national guideline. So, see how a valid research has influenced the guideline from shifting 5 days of primaquine to the 14 days of primaquine. So this is how, if you really uh, conduct a good research, meaningful research, then it should definitely influence the guideline. It influences many more lives. Ultimately, we are doing research to answer some clinical questions. And why we are asking such clinical questions? For name, fame? No. For publishing paper? No. We are actually conducting research to influence the lives of the patient because ultimately they are the patient who are getting enrolled in your research and out of whom you are getting your data. Contributes to a greater good, of course. The inferences of your research, if it is positive or negative, doesn't matter, but actually adds something more to the existing scientific knowledge. So you are working as a translational part of the knowledge. So this is called something contributing for a greater good. And number last one is the fame. Of course, publishing paper is a quite fascinating job. If you publish any paper having certain meaningful condition, I'm not talking about the garbage in, garbage out, that you are publishing anything and everything, essay, reports. No. If you are publishing a good and nicely conducted research and out of which certain meaningful conclusion has come out, no matter positive or negative, that will give you the fame. But I have put it at the last because fame is not everything that you want in your research. Fame is something which will come along with your good intention to conduct the research. So the basic purpose of research I told you that bridge the gap between knowledge, knowing and unknowing. Okay. So research is basically bridging that gap. So a lot of people say that what is my role in research? I'm a clinical practitioner. Let me tell you, there is a very important concept. I will make a separate video on this particular topic called evidence-informed approach. In Western countries, even in certain places in India, like Vellore and some apex bodies in India, where there is a concept called evidence-informed approach. What does it mean? It means you have certain evidence. Suppose a patient is suffering from certain disease, right? And there are multiple therapeutic options for the disease. So the doctor, that means the practitioner, actually integrates the knowledge of the research for the betterment of the people. Out of 5 drugs for that disease, which drug is having good enough number of evidence? And suppose drug A is having a good number of evidence or very strong evidence for ameliorating that particular disease, but it is having much more side effects. So doctor is not considering that drug at the first place. But the second drug is having little less efficacy, but it is drastically reducing the harm that the first drug actually brings. So the second drug will be the choice of the drug for that patient. So just they are discussing with that approach with the patients, and if patient consents, then patient is having also the right to choose their healthcare journeys, right? So this is called evidence-informed healthcare approach. So basically, the goal of evidence-informed healthcare is to ensure that decisions about various level of therapies are well supported by the best available research evidence. If you don't have the research evidence, if you have empirical data, you can also use it. But if you have a good amount of research evidence for certain medicine, that will stand out of this particular empirical drug. So basically, the evidence-informed healthcare is the integration between the practice, people, and the research. So that means that clinicians are not refrained or excluded from understanding research. So they have to understand research and their people to integrate those things to inform the evidence-based approach. So there is a very important life cycle of the research. I will talk about this in detail later. So first, a medical research, if you want to conduct a research, it should start with a huge literary research. Suppose you want to conduct a trial on osteoarthritis therapy with certain drug, so you have to understand that what kind of existing literatures are there, which will inform me that what is my place. Shall I conduct that particular trial or not? So first you should do the huge literary research. So literary research consists of books, magazines, journals, PubMed, different indexing search, all these things. Then you have certain idea called generation of idea. Okay, suppose drug A, I just wanted to test drug A on osteoarthritis pain, but I found that drug A is having enough evidence. So, but drug B is somewhat effective in osteoarthritis with little harm, but there is not enough evidence. So I can actually explore the therapeutic efficacy of the drug B. Or drug C is having a very little evidence, but it might have certain good therapeutic effects than drug A, drug B. So this idea actually will come to your mind after going through hell lot of literatures that you collect on that particular topic. And after that, you have refined questions called research question, and you gradually prune that question to be specific. And based on that questions, you actually prepare your synopsis or research proposal, which is called methodological proposal formation. It contains the background, on which background you have just come out to the idea, then introduction of all these things, then research question, hypothesis, all the methodological parts, including study design, objectives, outcomes, etc., etc., and also the statistical plan and various annexures. So this called is research methodology. It is a blueprint which will tell you at which way you should go to conduct your research. After that, you just implement, you get your synopsis or proposal cleared by the institutional ethics committee, who looks after whether your research actually focuses over the ethics, over the human part or not. It is actually preserving the human autonomy and respect or not. And if it does so, then they will clear your research. It's called ethical clearance, and institutional ethics committee does that. After getting clearance, you can start enrolling your data, enrolling your patients, and start collecting your data. After all the follow-ups and everything goes off, when you just get yourself complete with the targeted data that you wanted to collect, which definitely was mentioned in the methodological proposal, then you analyze those data through a consideration called biostatistics. And after statistical analysis, you find something relevant information or inferences. And based on those inferences, you say, okay, this is the answer of my research question. So starting from the literary research background to the analysis and inferences, all this journey is documented in a research paper and disseminated, either by means of presenting in certain conferences or publishing into the index journals. So I hope you have understood the basic life cycle process of a research, and then I want to draw a little idea about the evidence-based medicine pyramid. It is basically based on certain study designs that we consider in research methodology. I will also tell you about this in a very big detail, but An evidence-based medicine pyramid is having a lot of misconceptions in people of medicine. They say that systematic reviews that this pyramid is based on the least importance to most importance. Least importance information are the background information, expert opinion, non-evidence-based medicine guidelines. Then little more important is the individual case report. Then little more important is the case series. Gradually, most important is the RCTs and meta-analysis. But the thing is, it is a very wrong notion about the evidence-based pyramid. The pyramid actually says that if you have multiple level of evidences during the treatment of the patient, right? But if you have two paper of drug A, very high quality randomized control trial, or a paper of systematic review and meta-analysis, pooling the results of all those randomized trials and concluding, yes, drug A is effective in that particular disease. And in meanwhile, you have a expert opinion or case report of drug B saying that yes, it is effective in this disease. What would you choose to treat your patient? Of course, the high quality randomized control trial paper of a drug A, because it is having more strength, less bias, and more data that this drug is effective than drug B, which is only having a case report that it has cured one case of osteoarthritis pain. So evidence-based pyramid is saying, conveying that particular information. That during treatment, during the care of the patient, individual patient care, what kind of evidence you should use if you have multiple piece of evidences. So this is the hierarchy. If you have, suppose, good quality cohort study and same times you have case report, you should concern the cohort study more than the case report. So basically, this pyramid is meant to treat the patient based on the available evidence we have. That's why it is called evidence-based medicine or evidence-based practice pyramid. Okay. So thank you very much for your patience hearing through all these elements concerning the basics of the research. It is just a laying stone to your concept. So therefore, in the next few videos, we will be talking about the basic biostatistical considerations and how the research works, what are the basic research methodological frameworks, and etc. and etc. Thank you very much.